that is what this means. So each group may come up with something different, okay? So you're going to be getting together, coming up with 3 terminologies that you think that you've communicated well together as a group and have agreed upon as a common terminology, whether you're talking to each other or to a patient. All right, we got 5 minutes. They're waiting for us. Chicken wing text. Yeah. We had a patient that's like been trash stretched. I would do this with him. Because this is Mary, she's been this on the wall. And that is what we want with this. But when I read it, I said, oh, it's just go up like this. Yeah.
So it's different.
Because we already see it.
I see the cow.
I said, I'm sorry, I don't know. Are you getting someone to make some notes? Okay.
Yes, Betsy is. John didn't give me my.
I see Cody's making notes. Is John being our note taker over here? I have an extra pen. Somebody needs that.
I mean, I did, you know,
The pool exercise.
Or I guess you could look at like your 3 by 10 equals 0, which they couldn't tell me that initially. That means actually put this in that little extension device thing. But it's been turned over. So really, like, we're using that, but that's not what it initially was. So then when I went to go use like the little device, I said, oh, I called it.
So you're finding an additional communication thing, which is what we call specific equipment.
Yeah, well, because it's been given a new name.
Okay.
He's like, that's
Well,
what
we're all pretty much,
what do you want me to call it?
so we all know what that's, so we know what the.
Stretch has always been on the round thing, you know, that.
Yeah. But he said that that's what those, but I was looking through the doctor's notes here, it was like,
Okay, this is your 1 minute warning, so start coming to finalization on year 3. How y'all doing? Now you get a big list over here.
So is that the one that puts the leg down? Okay.
Is everybody okay, man?
My favorite part is watching y'all do these. Come in, get a cat. All right, guys, if you'll start picking the person who's going to come back and tell the group what y'all decided. All right, which group is just eager to start?
We will start.
Oh, good job.
I'm eager.
They're eager.
Get her done.
Okay,
Okay.
what did y'all decide when you did your common terminology?
One of them was the 3 by 10 equals 0.
Okay.
Because at some point it kind of,
What about here?
sometimes that kind of morphed into just doing a prolonged extension stretch.
Okay.
The weight on the knee. But maybe it was originally, maybe that sort of exercise was supposed to be where you actually have the strap.
It was actually 3 times a day for 10 minutes
Yeah.
strapped on the board, is what it originally.
Okay, so what did y'all decide is the final common terminology of that? Did you decide one or the other? Because it sounds like we still have 2 definitions.
You still have to.
Okay, so this is still a question. Okay. All right.
Pull aparts
Okay.
is a jargon, or a term.
Okay. What did y'all decide? Is that a helpful term? Is that a everybody understands
I feel like
it?
that's one that everybody understands what it is.
Okay.
It works here, but if somebody
this
new
is a
came
check.
in, that would be like,
Okay. So it's a check for here, but maybe questionable outside. Okay. What else?
the chicken wings.
That's all that
That's
is.
what's this
Chicken wings. Okay.
So it could be upright or whatever, or it could be like this, or it could be like, I call it this. When I'm stretching back like this,
Oh,
it's
okay.
stretching from the shoulder. I'll call it that.
So we got a lot of different chicken wings going on. Okay, so this one we have not decided quite yet.
Right.
This will be a future project, I'm gonna guess, common terminologies and exercises. Okay, so you guys are identifying already what we've got to look at. Okay, that we probably won't accomplish all today. But we'll have a list that we can use for a future plan. Okay, what about our middle grade?
We followed directions, we came up with the ones that everybody knows.
Okay.
That's my group number one.
That is, maybe I did not communicate the message well, so that's good.
That's
Okay.
Karen.
So these are the ones that you
Straight leg
agree.
raises, we think everybody knows SLR, straight leg raises.
Okay.
And also LAQs. I think everybody pretty much knows those. And HS curls, and hamstring curls, we figured out those. And ooch outs.
Ooch.
Yeah.
Ouch.
Yeah. Yeah.
Okay, this is the common terminology that everybody agrees upon.
Yeah. I mean, when they're on the flow sheet, everybody knows what.
Everybody's good with ooch and out.
And then we also thought the pull exercises with weights. Everybody
Okay.
pretty much has those figured out.
Okay. I'm gonna put a little question here.
So remedy.
Like this be for later discussion for me. Okay. All right, and the last group, what did y'all come up with?
Okay, we also had straight leg raise,
Okay. So yay, this is a common.
and then we did shoulder flexion,
Okay.
although a patient might not understand that.
Okay, so the question of a patient. Okay. And chicken wings. And how did y'all perceive chicken wings? Flapping like a chicken dance versus he's, I'm not sure, sprinklering, I don't know what this is. Okay. We're gonna keep working on that in the future plan. Okay, so you can see even amongst us who do this on a regular basis, we've got different ways of thinking about it. We don't even realize. So even if John's sending a message, I want you to do chicken wings, I might go down the hall and be like, okay, we're going to chicken wing it up. And then I come back and he's like, why did you do this one? Right? But I didn't know how to listen better and check for understanding. All right. So let's talk about what does listening better entail. And y'all have already mentioned it's not spelled correctly. Thank you for noticing. So here's how and why it's spelled that way. This all comes from Fisher and Urey. This is their way of helping to help negotiate and mediate with people. And it's a way to actively listen. I know you've probably been to a training before on active listening, and this is kind of another format of that. But it's called the listening procedure. And for this, LI is for listening actively and you're acknowledging what's said. So if John were to say, I need you to do chicken wings, my acknowledgement might be, okay, John, I hear you say you want me to do chicken wings. So that way he has a chance to know that I'm hearing what he's saying, and I may even give him a demo to listen actively. And that way you're giving some feedback immediately. And I know that sometimes we don't have time to do that, or we think we don't, but it only takes a little bit longer, a few seconds longer, to clarify, as it does for you to hear it and run down the hall and not clarify. So you're going to get a better result if we're able to listen actively. And then our S's here are speaking to be understood. And Fisher and Urey talks about sometimes when we speak, and I think everybody is guilty of this at one point or another, we're speaking in a way that we understand it, and we're assuming the other party does also. And we may not be speaking so that the other person can understand us. So maybe if John were to ask me, he may want to speak and say, I need you to go down the hall and do chicken wings and show me, so then when I'm checking with him by listening, I can say, I hear you saying you need me to do chicken wings. Okay? So sometimes we think we're saying something, and I'm guilty of this, I know. I think I'm speaking to be understood, but really I'm understanding it myself. And I may not be using the words or the common terminologies that help get it across. And we're speaking for a purpose. One of the things that Fisher and Urey talks about is when we speak for a purpose, when we're in a setting like this with a business organizational type of setting, we do a lot of speaking during the day to each other. I realize that. But when we're talking about patients and patient care, you guys have already said that's the most important. Those should be the times we're speaking with the most purpose. And when we speak purposefully, it should be very specifically, and we should have the time to speak purposefully about feedback. And be able to say, I hear you saying this, but I don't understand what you want me to do, or, you know, I went to see them earlier and they're refusing, so now what can I do? So you have a purposeful conversation, not just, Oh, I went down there again, they don't want to do it. You know, that's not a purposeful time of speaking. And we're all guilty of that because, again, we have very busy schedules and we're trying to see so many people. But speaking with a purpose is really important if we're going to help people meet their outcomes and their goals while they're here, whether it's inpatient or swing bed or outpatient. That's what we're trying to work toward, is meeting those outcomes. So we have to be purposeful with some of our communications. So just be thinking about that as we're going through some of the process here. And the 10 part is reflecting on what was said for 10 seconds. Remember I said it doesn't take that much longer if we're communicating with each other for you to stop and think and give some feedback. And sometimes as soon as we hear something, we have a tendency, all of us, because this is how we got into this field, to jump and go do, because we're doers. But sometimes it takes just a minute to be a reflective thinker, and it's a hard process to get into, to think, okay, what does that mean? What am I supposed to do? What do I have questions about? Before you jump and go. So sometimes just taking that 10 seconds may be helpful as far as clarification. Okay? So I'm going to give you a chance to practice some of these things. We're going to do a little role play. Okay? I know you're excited. And all the role plays that I've created here today are based on real scenarios that have come up either in our department or in the hospital. Ones that have maybe had successful outcomes or maybe didn't. So you're going to get a chance. So if you'll get in a partner, I know you're eating, I'm sorry. If you'll get with a partner, John, maybe with Mary. Okay, I'm going to give you about 3 or 4 minutes to look over your scenario. Then I'll give you a little bit of time to play through it. Then you're going to give a little bit of feedback. Okay? Okay. So read through it, kind of get an idea about who you're going to play, what you're going to do. Are y'all okay back there? Are they decided about what role to be? Okay. I'll make you start if you don't want to. So just read through it and see if everything's good.
Hey, but this happens every day.
Well, okay, good. That's perfect.
Okay, what do I?
Again? Y'all know who's going to do what? I heard y'all saying who's going to do what.
I'll be the point. I didn't say that. No, yes.
Okay. I'm going to switch yours out. I decided what I'm going to like.
I guess you could do chicken.
I'm going to switch out.
So I guess you're just asking further questions, like. Well, I'm just gonna do.
Sorry, what?
I'm just gonna tell you. So you're gonna come to ask me about this patient.
No, I'm going to do that. As I say, are y'all ready to role play it?
Yeah, just try how I feel this.
It's very improvisational. I know there is not a script for it. You may or may not have experience in this situation. If you do, feel free to use that, but don't use names or anything like that. So, okay. So who wants to start our role play?
We'll go first.
You're going to go first. Okay. Why don't you read us the scenario? Read us the scenario and then give us a quick rundown.
A patient is not happy about his therapy session the way it's going today. He is complaining loudly to the aide and attempts to walk out. Play either the patient and the aide or an additional staff who is overheating and intervenes with the patient using skills learned today to diffuse the situation.
Are they overheating or overhearing?
They're overheating.
Oh, they are. Okay, hopefully they're not overheating. Okay, they're overheating. Okay. Shoot. Okay. It's okay. You don't have to be an Oscar actor here.
I thought she was going to get that.
I am, but I'm hyper-using over here. You know, asking me what's wrong.
Charlie, okay? What's wrong? What's wrong today?
Action?
Well, I was supposed to get my hot packs first. I always get my hot packs first.
Oh,
And
well.
then you bring me in here and just start my exercises. I'm not even warmed up. I'm still hurting. I'm still gonna leave and I'm gonna come back tomorrow.
All right, well, I can go get your hot pack for you today.
Well, my back's already hurting now. I mean, it's already too late.
Well, we can get you on a hot pack, we can calm that down a little bit, see if we can get you feeling a little bit better before you go. Would that be okay?
Okay. Wow, she just totally gave in. You're listening. Okay, so tell me, what listening technique do you think you used in that situation?
Hearing what I'm saying.
I guess.
I know you were hearing what she said because I heard you repeat it to her.
Yeah.
I heard you try to offer a solution. Did you have a chance to really pause and reflect for 10 seconds about how to respond or what she was
I
saying?
felt if I paused 10 seconds, she'd walk out the door.
Okay. And I can understand that because we've come into that situation before. So if you don't feel like you can, then still continue to speak. And if you understood what she said, I heard you say several times, let me get that for you so we can get on that. So you were trying to speak to be understood so she knew that you were hearing her. So
And
you
that
were
she was
listening.
trying to correct the situation.
Okay. All right. Who's next? Louisa Kaylin. Hit it. Let's see it. Sure.
Okay, let's go ahead and, we're gonna do chicken wings now, okay? Let's do our chicken wings.
Okay.
Just like that.
Okay, Louise, do you mind? I think I want you to do this kind of chicken wings. Because I'm really working on a different kind of motion than this chicken wings does.
Okay, that's good, I'm okay with that, okay. Let's do it this way.
Okay, what was your scenario?
Yeah, oh, that's right.
One of you is an aide overseeing a program in outpatient, and one of you is a therapist walking by who noticed an exercise is not being performed correctly. Show how you can intervene respectfully.
Okay. So what ways did you feel like you intervened respectfully in that situation? As far as stopping to
I
listen?
pointed out what I wanted to change, but I didn't say you're doing it wrong, and I told her why I wanted it differently instead of putting it on her more.
Okay. So listen, speaking for understood, speaking for purpose. Okay.
We'll go.
Okay. So you get involved chicken wings?
So our scenario says, one of you is a therapist and the other an aide discussing specific exercises for a patient. The therapist says, just do the usual for a need. The aide isn't sure of how to do this, but starts the session anyway. Demonstrate how active listening can create a better outcome.
Okay. And action.
Okay, what do you want me to do, John? I have a patient over here.
No, it's just Mr. Smith. Just do the usual for the need. It'll be all right.
Okay, so what is the usual? Strengthening?
Okay, he's lacking some motion in his knees, so we were working on his range of motion, and he's weak too.
What do
So
you?
those are the two goals.
Tell me exactly what you want me to do, because I don't understand what you want me to do. If you don't show me.
Okay. Let me have the chart. I'll just mark it for all.
You gotta show
So
me.
you too.
Okay, so you marked it on the flow sheet, but okay, so I still don't understand how you want me to strengthen.
Okay, so I'm gonna pause you because she had some good key words there. She said, I need for you to show me. And sometimes our response is, well, let me mark it, like you just said. So how could that change if you tried to do some of the listening techniques when you hear her say, I need you to show me?
Well, I should probably say, okay, here's exactly what I want you to do, for this particular exercise. Just take more time.
Okay. And I know some of it comes down to time, but we have to listen to some of those keywords like show me, what does it look like, some of those things where maybe someone's asking you for more than words, they're asking you for actions and for doing. So listening for the doing words is one of the things that a lot of the evidence I found talked about was sometimes we miss the doing words like show me, what does it sound like, what do you hear when they do that, those kinds of doing actions. Okay. All right. Good job. Go for it. No, we didn't. We got just enough time.
Scenario, you are dealing with an insurance representative or doctor's office via telephone on behalf of a patient trying to get paperwork back that is needed to provide services. Playing the insurance, doctor's office, and the person on the other end, play out how assertive communication might help to get what is needed as an advocate for that patient.
I realize you're a little bit at a disadvantage because we didn't talk about assertive communication, but I know you've seen this situation go down. I'm trying to talk to it. I know you've seen these ladies do it. We should have them role play. Okay, so go ahead.
Yes, well, I was calling because I have a patient here and is needing some services and they're having a little trouble getting some paperwork back. So I was just trying to get, to see what you can give me the information to get them started.
Okay, well, would you like for me to send a script over for the patient to get the therapy they need?
Yes, I will give you, here's the number you need and a fax number, and as soon as we can get it back, we can get started.
Okay, I will get that back to you today as soon as possible.
Thank you.
That was like the ideal scenario. Yeah, I just
If only.
I like the way that you did it, because you said, here's what I need, so you were doing that, the other person was listening, of course, they may not have been doing listening training, but you were listening and telling them what you needed, but I think these ladies will tell you, from their experience, it doesn't always go that smoothly,
No.
right? So what are some things that, if you were in Matilda's spot asking, what would you have to do to be more assertive in your talking to the doctor's office?
We need this plan of care to qualify for insurance, and this is our first step, and we need you to do this, where we can go on with our.
Okay, so are you
We
saying you
cannot
know
move
exactly?
forward without y'all taking care of it.
Okay, so you're being very specific, you're speaking for a purpose, you're telling them exactly what is needed, okay?
What we need before we can go ahead.
Okay, so those are some things. Okay, I'm gonna let y'all, you get an out on this one. Because we're gonna move on, but that means you need to go first on the next thing. Okay, you guys did a good job. And I know it's weird to think about role playing because it's not a real life situation, but all these situations happen all the time. So you're gonna come upon it pretty soon, I'm sure. Maybe just have a chance to think about it differently, okay? So in those same little groups that you just were in, the 4, right there, 4 and 4, this is a little group think activity. And so out of what we've talked about, and you can make it even more specific than the general listening tips I've given you. You may think of something really specific that's come about as we've been talking today. I want you to pick the top 3 techniques that you think are the most helpful for our department. So is it listening actively? Would it be speaking with a purpose? Would it be let's have common terminology? Think about the top 3 things that you think would be the most helpful for our department. Because we've spent a lot of time trying to figure out where do we need to improve. So what are the top 3 things you think would help us improve? And you can't say more time, because yes, I agree, that would be it, but. And you have a couple of minutes for this.
If I talk to movies versus I talk to people about something that could be, if I try to just comment more on it, and don't oh, that goes to the other stuff, that's what I was thinking.
Common terminology. I think purpose of what he's doing is to do exercise, to make the
Or the
They're on the purpose of things, treatments or.
the same thing.
And now y'all figure out who's going to present this at a future. John is the next speaker. Y'all already got yours. Take it over there, Drew. You're on 2,
I
okay.
think the terminology thing is kind of hard because I don't know in colorful terms as well.
As you don't know, our jaggers are jargon, whatever you call
Jargon.
it. Jargon.
Hopefully they're not jaggers or daggers. That would be bad. Okay, y'all start finishing, getting your last one. Did y'all get your last one?
Just
So like when you writing some terms and then.
This is like the GT group or something.
Yeah, fast.
Did y'all pick your third one over there?
Short and sweet.
That's right, short and sweet. Did y'all get your third one, Mary? Bring up shopping.
pardon me?
Are you bringing up shopping?
Oh, sorry.
That's actually listed right there.
Okay, let's go and start over here with this group. Give me some of your top 3 there.
Our common term, speak to be understood.
Okay, common terms.
Whoever you're talking to.
If you're OT and talking to an OT, you're okay.
Okay.
If you're OT talking to PT, you might not be okay.
Okay. PG understood, okay. And what else?
Active listening,
Learning to
Active.
confirm instructions.
Okay. Okay. Cody and Michelle and
Ours were active listening, but more restating what we heard.
Okay, so specifically the restating. Okay,
We also said common terminology
okay,
and then speaking with purpose, so that
okay.
if you tell someone the purpose of what you're doing, they might understand what you're asking them.
Okay. So we've expanded to top 4 at this point. Okay. All right, last group.
Common terminology,
Okay,
finding a common ground on, their terminology and our terminology, finding a way. Mary said, that we could write, like if John told us to do, the mid-trapeze stretch, and, we know it as the angel wings, we need to confirm with him, if he wants the angel wings or if he wants this one.
okay. So you're kind of going back to what they said about restating and the listening. Okay.
Yeah.
So maybe a little bit there.
Okay, and getting clearer on the purpose of treatment,
Okay. And so y'all even went further and went to treatment. Okay.
and learning to confirm instructions.
Okay. So that's still kind of restating, confirming. Okay. So you guys came up with top 4, and it sounds like common terms seem to be running through everything.
I was just gonna say real quick, the common terms is gonna be a lot bigger issue now because used to it was
Yeah.
Wes Bishop made all the plans.
Yeah.
So whatever he said is what he had in his mind as a
And
common
everybody
term,
just-
and everybody just learned it.
Right.
But now you got 6 different people doing evaluations, and in their mind, it works out differently. We are all very different therapists.
Right.
And think about things. So I'm not sure common terms like, what's what I'm looking for, naming something chicken wings is gonna be something that we're gonna be able to.
Okay.
We're probably gonna have to go more towards the anatomical stuff.
Okay.
And that's what John said,
We have too many people.
Which the active listening and the restating is going to help a lot, because when you're working with John's patients, you really need to restate what he wants, and he needs to tell you as compared to what Eddie wants or what Michelle wants.
Right.
I mean, just really, there has to be that communication between each therapist and each aide. There has to be.
Right. Okay. So you guys have kind of figured out we've got some other future projects that come from this, which is really what this was intended to be, was an initiation of just conversation to figure out what is it that we want to do as a department. That's what really all I did was gather the data and provide it back to you so that you can come together as a group. I should say we, because I'm part of it. So that we as a group can come together and see what we want to do to improve communication. So we've already found some of those things that will be future plans, like you said. Okay. So the last thing I just want to mention to you real quick was the assertive communication. And part of assertive communication, you guys have already heard me talk about being respectful with your requests. We mentioned that a while ago when they were doing the scenario. So think about the scenario that you heard and what we said about it. And assertive communication requires some balance, because you're trying to be assertive enough to get your point across, but not so much that you become abrasive. So that's part of having respectful language. So you've got some fill in the blanks. If you don't understand if what you're telling someone needs to be done, if you don't know if you're communicating it well enough, of course you're going to use active listening. But you can also use assertive communication. And most of this I pulled from Wisconsin Department of Health and Family Services. They had a project that was specifically related to healthcare workers working with families and patients. And they talked about assertive communication as far as keeping your treatments on track and making sure that that kept going. And one of the things, scenarios I should have given you was, a patient who kind of gets off on a tangent, you're trying to get them to stay on track to do the exercises. But that's a time where assertive communication can be helpful. So, asserting body language. And one of the things that they mentioned is making sure that you're facing the person, you're not turned away from them, you're trying to show them and demonstrate for them what you want. So that's part of assertive body language if you're there in person. I realize you can't do it on the phone. Using I statements, like, I need you to do this exercise now. We have to do it because we're running out of time. Or I need you to pick up the weights and let's get busy. So that way you're kind of asserting that you realize it's a lot of the time constraints or what's going on is based on what you need for that person to be doing. Giving the facts in a respectful manner. And you know, if anytime we come upon that where we see like, I don't think that's the way, like you said, I don't think that's the kind of exercise I want to focus on today. I want to focus on different muscles. So here's how I'm going to tell you this with the facts in a respectful way. That was a good scenario for that. Expressing ownership. Sometimes when you say, okay, how can you help us stay on track with the therapy session today? You know, can you be in charge of the timer? Can you help me I know I've had a patient wipe down the mirror afterwards. I mean, that was part of therapy too for shoulders. But so giving some ownership into it sometimes will help you get a little bit more assertive communication. And then making clear and direct requests. And I think Patsy mentioned that, like when she was on the phone, being assertive enough to say, I need you to get us this, this, and this by 5 o'clock today. And as Louise said, or else we cannot move forward providing the services to your patient as you would like us to. So you're still saying it very respectfully, but you're being direct and clear. Okay? All right. Do you have any questions? We're finally coming to the end, and I know we got to get back. For any questions, you can always come back to me later. It's not like we don't see each other all day, every day. I've listed some takeaway thoughts for you. I've listed a reference list that has everywhere that I pulled data, information, evidence, articles, any of those you can access to get more information. And then the last thing in your packet, if you would do for me before you leave real quick, or if you can get it to me by the end of today, because I realize I'm going to have to get back to text somebody, is a post-training survey. If you'll fill that out for me, give it back to me, be honest, yet respectful with your feedback, so that I'll know for the future what things I need to improve upon for presentations, or if there's something in the future that you want, that Cody wants us to get prepared for our group, write that down, because that might be something that somebody would want to prepare for a future presentation or a future discussion. So thank y'all for your participation. Thanks for eating your lunch, but yet being here. And I guess I will be seeing you in like 2 minutes when we walk down the hall. So thanks, y'all. Have a good rest of the day. Good job.